Okay, so today we're going to be doing a cardiac assessment on you, Josh. So I'm first going to start with the different anatomical positions that you can hear heart sounds. So right here is your suprasternal notch. And then over here is your clavicle, and about an inch down is your second intercostal space. The first intercostal space is unpalpable because it is behind the clavicle. So at the second intercostal space, that is your aortic area, and then to the left of the sternal border, that is going to be at the second intercostal space is your pulmonary area, and then the third intercostal space to the left of the sternum is Erb's point, and then the fourth intercostal space left of the sternum is your tricuspid area, and then at the fifth intercostal space, mid-clavicular line, is your mitral area or your apical area of the heart. Okay, so next I'm going to have the patient be laying down and I'm going to inspect the area. So I'm looking for any pulsations, and many times you may see pulsations here at the fifth intercostal space at the mid-clavicular line. This would be where your left ventricle is, also noting to be sure there is no lifting of the heart. Also, we would want to put our tangential light on this area, so if you could look this way for me, Josh. We'll be looking at the jugular vein for any distension. If there was any distension, that could be because of fluid overload, and you could see pulsations in the vein. And I do not see any distension or waves in his jugular vein, so he does not have an increase in venous pressure. Okay, so now I'm going to be palpating the different areas of your heart, Josh, and I'm going to be using this area of my palm right here. So just a review of the different areas. This is your aortic area, the second intercostal space to the right of the sternum. And then this is your pulmonary area. This is Erb's point, and then the tricuspid area. And then right down here is the mitral area or aortic area. To feel the apical pulse, I can go to the fifth intercostal space, mid-clavicular line. It should be within one intercostal space of this area. If the heart was enlarged, it would be way over here in this area, but thankfully I'm not feeling anything over there. Okay, so next we're going to feel for some vibrations. If there are any vibrations, then we know that there's probably some turbulent blood flow or murmurs underneath where we're feeling. We're going to feel with this part of our hand, and this part of our hand helps us pick up any vibrations. So I'm going to feel in all areas. So I'll feel in the aortic area, the pulmonary area, Erb's point, the tricuspid area, and then the mitral area or the apical area. I didn't feel any pulsations in either area. Okay, so now I'm going to be listening to your heart, and I'm going to do so in a very orderly fashion. And I'll be listening with the diaphragm of my stethoscope for any high-pitched sounds. Okay, so I'm going to start with the aortic area. The pulmonary area. Erb's point. The tricuspid area. And the mitral area. Okay, so what I note is that S2 is louder up here, and that S1 is loudest in the tricuspid and mitral valve. Okay, so now I'm going to be listening with the bell on my stethoscope for any low-pitched sounds or murmurs, and then S3 and S4 are low-pitched sounds, so I'm going to listen. Okay, so up here the S2 is louder. Same with right here, S2, the dub is louder. Then at Erb's point, S1 and S2 are about equal. Okay, at the tricuspid area and the mitral area, S1, the lub is louder than S2, the dub, and there is no S3 or S4 sounds heard. Okay, so here I have Josh laying in the left lateral side position. I'm going to be listening to his heart. Normally I would always have the patient lay on the right side, but because of the camera he has to lay on the left side. So I'm going to listen to the tricuspid area for any S3 or S4 and the tricuspid and mitral valve for any murmurs. And I would listen as well with my bell as well to each section. And I would listen for the full course of the full lub and the full dub. Um, and I don't hear any aortic or pulmonary murmurs. I don't hear any S3 or S4 as well. Okay, so now I have Josh sitting up for this one. So we're going to try a technique to bring out the aortic and pulmonic murmur. So I'm going to have you lean forward a little bit, Josh, and I'm going to listen to the aortic and pulmonic area. And as you sit forward, this helps bring out any murmurs in these areas. So I'm going to be listening with the diaphragm and the bell of my stethoscope. And I don't hear any murmurs in the aortic or pulmonic areas. Okay, Josh, so now we're going to take a look at your peripheral vascular system. We're going to start by checking all of your pulses. So right up here is your temporal pulse, and that is +2. And then right down here is your carotid pulse, and I would never feel both at the same time, and that is +2. So the temporal and carotid are +2 equal bilaterally. So now, can I see your arm, please? For the brachial, I'm going to have you hyperextend just like this. I'll feel for the brachial. This helps bring the pulse closer to the surface, and I can feel it right away, so +2. And I'm going to come right down and check the radial pulse, +2, and then the ulnar pulse, +2. Okay, now for your popliteal, I'm going to have you lay down for me. Okay, yep, so I'm going to have you bend your knee just like that, and I'm going to feel right here. And yep, it's +2. Okay, so let me just see your foot. This is where the dorsalis pedis is, and that's +2. And then, thank you, and then right in here, that is your posterior tibia pulse, and that is +2 as well. Thank you. Okay, Josh, I'm going to be assessing your respiratory system now. So just by looking at you, I can see that your posture is upright. I don't see that you're having any distress, any nasal flaring. Your skin is warm and pink and dry. Can you go like this for me? Okay, good. So your nail angle is 160 degrees, so that means that there's no clubbing of your fingers. I'm just going to look right here at your conjunctiva, and good, it's nice and pink. And I'm going to check your respirations. Okay, and they're 17 breaths per minute with a normal rate and nice easy breathing, which is good. And I don't see any intercostal retractions as you're breathing. So, okay, thank you. Okay, Josh, so now I am going to palpate your back. Let me know if you feel any tenderness, okay? Is that tender at all? Okay, so I don't feel any masses or any crepitus or any tumors. And did that hurt at all? Okay, thank you. Okay, Josh, so now I'm going to check your thoracic expansion around T10. So I'm going to put my hands right here. Okay, can you take a nice big deep breath for me? Okay, good. So you have good thoracic expansion, and I can note equal movement when you take an inhale and when you exhale. Okay, Josh, so now we're going to do tactile feminist, and I'm going to be using this part of my hand to pick up any vibrations. So every time you feel my hand placement move, say 99.
99.
Okay, good. So I noted that the tactile firmness decreases from when we go. It's strong at the apex of the heart, then it decreases as we move to the base of the lungs. Okay, Josh, so now I'm going to ask you to give yourself a big bear hug and we're going to practice percussion. So I'm going to percuss your lungs. Okay. So I can note that there are resonance throughout your lungs and that the dullness occurs as you start to get down here in your lungs. So lungs are resonance throughout, and I would also do this anteriorly. Okay, Josh, so now we're going to try something called diaphragmatic exertion. So it is going to be measuring between the amount of air you take in and the amount of air you take out. So I'm going to have you take a deep breath in and let it all the way out and hold it. Okay, you can breathe normally for me now. I'm just going to put a piece of tape right here. All right. Thank you. Now I'm going to have you take a big deep breath in and then hold it. Okay. Okay, now you can breathe normally. I'm just going to put another piece of tape right here. Okay, and that is for your full inspiration. So the first line is your exhalation and the second line is your inhalation. So now I'm just going to measure the distance in between. Okay, and I'm getting about 4 centimeters, which is within normal limits of 3 to 5 centimeters. And I was also do the same on the other side just to make sure it was the same. Okay, Josh, so now I'm going to auscultate your lungs, and we would want to oscillate them posteriorly, anteriorly, and laterally, but for the purpose of this video, I'm only going to do them posteriorly, but I would do them anteriorly and laterally. So I'm going to have you take some big deep breaths through your mouth, in and out, and if you become dizzy at all, please let me know by just raising your hand. I'm going to be listening for a good deep breath in and out fully. Okay. So if you could take a breath. Good. And again. Okay, for the purpose of this video, I will just show you where the rest of them are. So listen to right here, 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 and right here. Okay, and everything looks good and sounds clear. Thank you.